I just wanted to take a minute and thank everybody for their support and what we're trying to do with Pranktunes. Pranktunes.com will take you straight to our YouTube channel, but we can also be found on Facebook and Instagram at Pranktunes Official. We'd also like to ask you for your help. Be sure to subscribe to our YouTube channel. It's the only way that we can become 100 heirs on YouTube. Jimmy, you got anything?
You people are endlessly caught in a flowchart that has negated all common sense.
All right then. Y'all enjoy the episode.
Well, I blame you people. It's you people in the restaurant industry that caused this trouble.
You people.
Right. Yeah, they only gave me.
It's you people.
They only gave me 12 hydrocodone for pain because of you restaurant people taking them.
Yes. Well. Right. Exactly. Right. Speaking of your hydrocodones, okay. So do you? All right. So listen. All right. So let me get you caught up to speed. So Thursday afternoon, I text him around 4. Hey man, how you doing? I'm checking on you, whatever. He says, I'm in pain. I'm at home. Everything's fine. I get home, and then at 11 o'clock that night, I get another text. Oh, I'm at home. I'm in a little bit of pain, but everything's fine. And I thought, who are you texting, man? Who are you trying to text? So I asked him. I said, do you know who you're texting? And the conversation was weird. He was high as a kite. Still, to this day, do you know who you were trying to text?
It don't matter.
It don't matter.
It don't matter.
I kind of figured you were trying to text Barron because I saw him when I was texting you at 4. Barron was in the restaurant.
He may have texted me at some point. I don't know.
So I thought maybe you were trying to reply to him and accidentally replying to me.
I was jacked up like a 48 Plymouth Gasser.
Yeah,
all right?
I know you were. Right. So I thought you were fucking high as fuck, as you should be, and still in pain.
And now I got some kind of damn sore throat's making my mouth break out, like I got like a bacterial infection. Like
I think they call that thrush.
In my throat?
Yeah. Now I'm telling you medical things. I thought you were the
So I got like
wizard
sores breaking out on my lip and sores breaking out. Maybe you think it's
Are you well that too? Are you taking antibiotic or no?
No, I got Flagyl and Hickey-Doo intravenously at my surgical appointment.
Right.
But if I go to the doc in the box, they're going to say, here's an antibiotic and a storage shot. Go home. It may be thrush.
Right. Well, normally that comes from an antibiotic, but yeah.
Yeah, thrush does. It's a crud. I've had a sore throat, and it's gotten worse this week, and now I got some sores breaking my mouth. I'm like, it's the same thing. it's.
Well, your body's panicking out.
It's some sort of bacterial crud I've got, and it's causing me to,
It is what it is.
So you go to go to the doctor and get something for that.
Right.
But the belly?
Yeah.
I never had surgery before.
Well, I gathered that because the last week when we spoke, I wasn't going to say anything, but you acted like, I'm going to go in and have this hernia repaired, and then I'm going to be, it was same-day surgery. Everything is a fucking outpatient procedure.
They don't keep you anymore.
Look, they fractured my skull and had to fill it back in with bone shit, and they fucking sent me home an hour later. Right. Well, I'm just saying, everything is a fucking outpatient
Unless
surgery
you're getting a heart valve replacement, they keep you overnight for that.
Right.
But everything else is same day because it costs too much to keep you. And your insurance didn't pay enough, so then once you go home.
Right. Right. Women have babies and go home the same afternoon.
So
it's fucking ridiculous.
This was, I've never been on anesthesia, so I'm laid up in there in pre-op.
Right. Now, you went with now I know there was a discussion over general versus local. I know you was going with the local. How did we end up?
Well, after I caught the anesthetic nurse practitioner lying to me, I surrendered.
All right.
She told me that they would be unable. I said I'd like to do it under local, and she said, well, it's not really possible to anesthetize the muscle wall in your abdomen. So I responded. I'm sorry, I did not respond. What went through my head was, ma'am, it's called a TAP procedure, and you're going to put the anesthetic between the muscle and the layer and the fat layer, and it's going to last approximately 90 minutes and has a very short half-life. I know all about the procedure, but you're going to tell me there's no such thing. And so I didn't say anything. I just kind of tilted my head, looked at her.
Right.
And she looked at me for a long time and then said, would you like to speak to the attending physician? The attending, I don't know if you know anything about how a hospital works. This was a nurse practitioner. So you got PCTs, and then you got nurses, LPNs, then you got RNs. then you got nurse practitioners, then you got residents, then you got attending physicians. You don't get to talk to the attending physician. The look I gave her told her, yeah, would you like to speak to the attending physician? I thought, you know what? You people are endlessly caught in a flow chart that has negated all common sense.
Right.
Let's not waste people's time like you're wasting mine. No, I don't want to see the attending physician. Fine, do it under general anesthetic. So I get up there and they put the IV in my arm and I wait half the day and lay around in the bed with this thing with the hospital gown on and my ass hanging out. I got to go pee 3 times.
Right.
I'm a pain in the ass patient. And then I get to cross the red line.
Right.
You know, red line's where surgery is. And it's very extraordinary to cross the red line. You don't just cross the red line. You don't take a tour over the red line. You see everything else.
Right.
The red line is a big deal. That's where the actual OR is at past the red line. Well, I went over the red line. When we passed the red line, I said, woohoo, we passed the red line. And they all looked at me like I was some kind of freak. They just don't know me.
Of course they don't.
So we get back there, and, you know, the operating room table is about as narrow as a 2x4.
Right.
So they can get up on you and job in you good. And they want you to,
Right.
you know,
They don't want to have to lean
They
over.
want you to do the reverse worm over on that thing somehow. Like, you're going to do this break dance over on this little table, which I did.
Right.
And then they have roll call, like I was in a go-go bar.
Yeah.
They went around and around, everybody called off. Lisa, I'm the circulator. John, I'm the anesthesia resident. They all called on, and I thought, is the feature dancer coming out now? They're going to have roll call? What are we doing? Yeah.
Right.
I'm laying there.
Right.
And then they put this mask on my face. I said, hey, whoa, what is that? And John, the anesthesia resident, said, it's oxygen. And I said, I'm a little frightened. I remember that. I said, I'm a little frightened. And somebody was over here jacking around with my IV.
Uh-huh.
And I looked over at him, and I said out loud,
Yeah.
oh, shit. I said out loud, well, that feels strange.
That's God.
Of course, the party was over at that point.
Right.
We'd had the party, and everybody had gone home.
Right.
So I don't know exactly what I said in recovery.
Which is a shame, because I would love to have a recording of that, because I'm sure it was fucking brilliant.
But
I'm sure
I
it was
know-
full on Jimmy the asshole
I
talking
solved
shit.
some of the world's problems in recovery, I'm pretty
I
sure.
feel quite certain that you did.
So when I woke up in recovery, apparently I had been awake for quite a while.
Right.
When
Doling out philosophy.
Yeah.
I'm quite certain.
Look, it was so good that they had a computer in front of me, and they had the Single Action Shooting Society website pulled up.
Right. Right.
It's a shooting sport I participate in, and I was
Yes.
like, I saw it and thought,
Right. What has happened
oh,
here?
shit, what have I done? What,
Right. Yes.
What did I say?
Right.
What could I have possibly said
He motherfucked somebody.
that would cause these people
I'll
to
bet you-
call
I
up the
guarantee-
Single Action
right,
Shooting
if I had
Society
to
and the
guess-
computer in the recovery room?
I think if I had to guess, you motherfucker, you gave out some fact, and they disagreed with you, and you motherfucked somebody, and you forced them. They said the only way to get this man to shut up is to get the computer out and take a look at what he's talking about.
When I left, Sarah said, who was my recovery room nurse,
Right.
that I had been the most interesting patient she would have all day.
Right. Right. And have you looked on YouTube since then to see if your diatribe is on there?
John, I'm sure it was.
Because if so, we need to buy the rights to it, because this is bullshit. Because this is what we're doing. Our
I'm
conversation here is we're going to copyright and patent it and package
I'm
it.
sure what I had to say was pleasant.
Right.
Because she was all smiles.
Right. Yeah. Oh no, I'm sure you gave them the song and dance and tipped your hat and tapped your cane. I already know what you did. I just wish I had the audio of it, so that Jim could animate it, so he could draw the character. And I can
Jim,
animate
listen,
it for
man.
us, and we can
not-
publish this.
Listen. Do not.
Right. Go ahead.
It's just like old brother where art thou. You know, do not blow out your belly button.
Right. Yeah.
This has been the most god awful thing.
Yeah.
Yeah. Yeah, that's separate.
Umbilic. Yeah. No.
There's neither am I. I just play one on TV sometimes. I just get asked one if I'm at the hospital.
Right.
Right. There's like a periodontal and an inguinal. There's a bunch of different kinds. And normally only infants have a herniated umbilical cord. And their intestine shoots out through it, and it'll fix it till they're 3.
Right.
Because it doesn't hurt anything. And then it's fine, you never know it again. In my case, somehow or another, I think my pregnancy may have done it. But I just got up one morning and looked in the mirror, and my belly button was almost gone. And I thought, well, that's weird. So I put my finger in it and pushed. And whatever that was taking up the space went back inside my stomach.
You know what happens when you put your finger in it? I mean, you're old enough to know that things happen when
you
you
go blind.
Yeah, you go blind doing that. That's
I have a perfect belly button. My grandmother was a belly button queen. She took care of all the grandchildren's belly buttons. We all had perfect belly buttons. I had a perfect belly button. Yeah, an innie and an outie. Yeah, blown out. No, mine was a perfect in belly button. It was flat in the center and had 4 petals in it, just exactly medically perfect. And now, and now it's fucked up as a soup sandwich. Okay.
right.
Yeah, I could put my whole finger in my belly button and then inside myself. I could finger my belly button and it went inside my guts.
Right. Which is not good.
No, it was just like, oh shit, what's that? It didn't really hurt. Hernias usually don't hurt until they strangulate or incarcerate. So if it strangulates, it cuts the blood flow off, and as you can well guess, if it incarcerates, it's trapped. It can't go in and out. So mine neither strangulated or incarcerated, but it needed to be fixed. And they fixed this motherfucker all right. Oh shit. They fixed it.
Right, and all I'm saying is that the fact that you thought that you were going to rebound from this, like they were taken off on, you go to the dermatologist, you got a mole we need to remove, no big fucking deal, 0 recovery time. This is some fucking recovery time. That's all I'm saying.
I'm here, ain't
I? I know you are. I know. I told you there was nuns and kittens and there was a fire. He was saving.
Straining can do it. I'm
Right.
not positive when it happened, but it could definitely be that I blew it out, turning the bus over and saving the nuns. Yes.
Right. That's why you got to bend to the knees, not with the back.
I looked in the mirror one day, my belly button was disappearing. It was just weird. Something was wrong, and I stuck my finger in it and it just kept going.
No, so yes, at some point he picked up something very heavy, and it ripped, and it ripped, and it ripped the.
Like within the last couple of weeks, it ain't gonna go several years. You not notice it. Your belly button is disappearing. You're so that's weird. And you put your finger in it, and there it'll go whoop, all the way in. Didn't hurt. Now this hurts, and I'm better. I mean, you're right. It was a procedure.
Yeah.
Billy Crystal, said you call it a procedure, but it's surgery.
Right. Yeah.
Just a procedure.
Right.
I'm going to call it a procedure.
Yeah.
It's really surgery. But the next day, leaving up there, I was pretty jacked up. The next day, I was pretty jacked up. But it gets better every day. Now, let's be clear here. I'm following the doctor's orders. I'm supposed to walk around. That's good for me.
Yeah.
I don't lift anything over 10 pounds. I don't do vigorous
So Michelle helps
exercise.
you go to the bathroom then. Is that what you're saying?
The bathroom is a different and interesting story I'm not going to go into.
Right. Okay.
They gave me a Foley catheter. You ever had a Foley catheter where they stick the hose in your unit and then blow the ball up in it?
No.
Never had one.
Sounds like lots of fun.
Yeah, and then you can't pee. And they take you to pee, and they say, can you pee? And you're like, well. And to quote myself, I said, I can pee anytime. You become a good soldier, I can always pee.
Right.
They took me in the toilet, and I stood there, and
Right.
Come on, Blue.
Right.
I couldn't pee. It
Right.
took me a few minutes to pee, and they were like, that'll get better. So that passed. So anyway, I'm following the doctor's orders. I mean, yeah, have I been up and around? Absolutely. I have done some things, but I've done what the doctor ordered me to do also. The doctor didn't say,
which is good because
play me back with ice. Had he
Right.
just said that, that's what I'd be doing.